Hello and welcome to The Talk, a dental protection podcast for dental hygienists and dental therapists. My name is Claire Stott. I'm a dental hygienist and case manager here at Dental Protection. And today I'm joined by Anna Middleton, who is a multi-award winning dental hygienist and therapist, founder of the London Hygienist, a key opinion leader for Philips, a global ambassador for EMS, and much, much more. So thank you for being here, Anna, and taking time out of your busy schedule. I'm sure there's much more that I could have said, but I hope that was okay as a little introduction.
That was a lovely introduction. Thank you so much for having me.
But I thought it would be good to speak about wellbeing and resilience, because the hygiene and therapy profession, it does come with many challenges that make it hard to be resilient and positive all the time. And Anna, you've achieved so much in your time as a practicing clinician already. Can I start by asking what challenges you have faced and how perhaps you've overcome these?
I think some of the challenges first started straight after qualifying, finding a job, finding my feet, finding a space where I felt that I belonged, challenges of being supported. These are all things that, very early on had quite a deep impact on me. I felt very lonely, isolated. I feel when I qualified, there wasn't perhaps as much of a sort of community that I feel that there is now for hygienists and therapists in the forms of, online connections, courses, specifically aimed at our profession. So, those challenges were hard. And, I still see other hygienists and therapists coming across various challenges, particularly, over the last couple of years and in light of coming out of a pandemic and sort of what the future looks like for us as a profession. There's so many things, and, anyone listening, must know that they're not alone in feeling the way they feel sometimes. I've been there myself. And I think it's, for me, it's always been a case of identifying what the problem is and then working towards finding a solution.
I think I mentioned before that when you were starting out, when you went to the hygienist events, you were the only hygienist there, and there wasn't really much of a community.
You're so right. And, there is a community, we have our societies there for us, and there's always been sort of events, through those that have been accessible, from our side. When I finally decided I really wanted to push forward with my business, networking played a really key part, but it wasn't just networking for the business. It was, to not feel isolated, to not feel alone. At that particular time, I was working on my own and didn't have a lot of help or support, and dentists were sort of my only friends, really. That's why, it was nice to go, and it's nice to see now that when you do go to sort of courses or events, that it's a much bigger mix of the profession present.
How have you made your career work for you to get that work-life balance? For those that I'm thinking of, maybe for those that are just starting out, where they might be in a practice and there's not really much support, they're seeing things that they don't really feel is right, but because they're perhaps newly qualified and don't have much experience, don't feel like they can speak up, or maybe feel somewhat trapped. I think just anybody looking at you, Anna, they might think, you've established so much. How have you gone about and established that work-life balance?
So the first part to that, I think, as I said before, I'm a problem solution based kind of gal. So whenever I feel that things aren't working too well or going too well, particularly say in work, I'll make a list of it. But when I've made that list, rather than say going to my principal, practice manager, dentist, and just announcing all these sort of issues, I like to come with some solutions and say, I've got an idea that we can, perhaps implement to try and make life better or work better, workflow, and it's one of those where you're sort of taking into consideration the greater team as well. That's worked quite well. I asked for a performance review the other day. I run my own business and brand, but I still work with other people, and I wanted to be, treated as the rest of the team are. And it's a really great way of sort of highlighting some of the things you want to improve on and work on and develop on, but also what does that then look like for you going forward in terms of your sort of progression, because we all want to be progressing and doing well and being paid properly for the things we're doing, as well as being supported. To then go sort of back to the beginning of your question, my advice to anyone sort of just starting out is don't rush to fill your week with hours in clinic. It is extremely overwhelming. It is tiring. And I think sort of picking up 1 or 2 days and getting into like a good flow and a routine really helped me find my feet, as well as looking for a role or a place where not only was I supported by the dentist and, for example, management, but also having other hygienists and therapists to lean on as sort of mentors and role models. And I've worked in plenty of practice now, and I'm still early in my career, but being able to support some of my maybe, more recently qualified colleagues, I say to them, come to me, talk to me. If you want me to go through your radiographs with you, want to, look at a treatment plan together, I'll, come and shadow me. So I think all those things where we can then learn from each other really then help as well. And I still shadow colleagues, and I have colleagues come and shadow me. But the learning process sort of never stops.
It's a really nice idea, because I didn't really have that myself when I started out. I just felt it was just me, really. And I think it was maybe 3 or 4 practices I had worked at before actually finding, a practice that I really felt comfortable. And you don't necessarily have to have a formal mentor, like you've said, Anna. It could just be some an informal mentorship, and trying to create, I suppose, a supportive network, not only at home with your family and friends, but also within work as well.
It's really important. And I still, I have mentors that are clinical and non-clinical, and I'll lean on them for support for different aspects and elements of my day-to-day life. And then, I think when you're organized as well in your day-to-day life and personal life, you're able to then manage clinic, even if it is a little bit stressful, high pressured. One thing I actually did when I first qualified was I actually did a lot of locum work, because I was, there wasn't many jobs offered at that particular time. And locuming gave me a really great insight and opportunity to sort of see what goes on in other practices, how other people work. But also it opened up opportunities, because, you do a few locum shifts, and often sometimes the practice would say, hey, we're actually looking for someone. Would you be interested? And you kind of almost get a little bit of a taster and a feel to sort of what's out there. And it helps to, again, just grow your network and meet people and learn how other practices, for example, run and operate.
Yeah, and test out the equipment as well.
Yeah.
This one has this one.
If you can find it. I remember working at a place and they barely had anything.
I know. I think I'd worked somewhere that had a really old machine. I don't even know what it was. And the tip guides you can get. It was like I used a tip guide, and it was like 50% of the tip was missing.
People did that.
Oh, dearie me. But Annie, you also do, as well as your clinical, you have non-clinical duties, and a lot of on the hygiene and therapy forums, there's some colleagues I've read that are feeling dissatisfaction or maybe overwhelmingly stressed and thinking of leaving the profession. And I thought it might be helpful to ask you how you went about just expanding your scope, but not clinically, in more terms of the non-clinical duties that you currently do. It's still connected with dentistry, but not, I'm treating patients. How did you consider, that?
What sort of started it for me is that I wanted to sort of raise the profile of hygienists and therapists. And that's some of the early things I started doing, was just writing articles for industry press. It was a nice outlet for me to have a different project to work on. And also there is something very nice about seeing your name and your words in print. It's something I've kept all my sort of magazine and press clippings in folders. It's something I like to look back on. It's also, if you have an interest, for example, in a particular, say, product or education space, to sort of reach out for those opportunities to see how you can, as a professional, help those people get their messaging sort of far and wide, and that collaborative element of work. As much as I love being in clinic, I feel that I need to still be stimulated outside. So, that's why I went back to uni. I did my therapy degree after hygiene. I've done 2 postgrad diplomas since then. I'm regularly attending courses. I feel when the clinic aspect became overwhelming, I found education and learning helped to reignite a sort of passion, and those skills you're then able to take back with you to sort of elevate what you do when you are in practice.
Was those postgraduate courses something you was able to do at the same time as working? You was able to manage quite well.
Yeah, no, it's fantastic. Yeah. It's they both were roughly about a year long, but it's once a month on a Saturday, and if so I did Dr. Monique's Fresh Dental Therapy postgrad diploma, and then I also did the Smile Dental Academy postgrad diploma, because when I left uni, it was straight off the back of COVID. I didn't feel I got as much sort of hands-on clinical time had I would have done if COVID wasn't present. So I felt I really wanted to, one, not feel de-skilled immediately after qualifying, and secondly, just sort of elevate the skills that I'd learned and take those a little bit further. And mainly it was a confidence thing, and wanting to be able to have the confidence for that. So both those courses gave me that. They, taught me skills that was sort of briefly touched on at university. So being able to take, good, high quality clinical photography, use of different materials, approaching, complex treatment planning, a little bit beyond just our single sort of cases. And again, I made friends. I got to spend time with, new people and learn from other people. And we all sort of help and inspire each other. So for me, when I get I feel like I'm falling out of love, or that I feel that the pressure's too much in sort of dentistry, I'm like, what can I do to reignite that sort of interest and passion? Because that's it now. I'm never leaving dentistry. So I have to make it work. And I want to be passionate about it, and I don't want to resent, ever be in a point where I'm so burnt out and resentful. And for anyone listening, environment does play a role in that as well. And there is nothing wrong in, creating perhaps an exit plan if you need to at some point. I've done it at several places before. I've left places, most of them still, actually on good terms. It just got to a point where the direction they were going wasn't the direction I was going. And, you never know, I may go back to them in the future if the sort of what I'd like to be doing is facilitated. And, if you are dreading going to work, that's not a nice place to be. That's not a nice energy to hold. And, patients pick up on it, your team picks up on it. You just walk around with that like a little stormy cloud over your head. And, we want everyone to feel their best. It's difficult enough as it is at times.
Yeah, and our role, I think, is changing. I think it has developed over the last few years, and of course we've got the changes with the NHS contract. So I don't know about you, but I think we are becoming more recognised as a profession. It's not just about, it's not a scale and polish anymore. We are doing a lot, and I think with therapy, with your course as well, and I think you're probably doing more private therapy. Is that fair to say?
Yeah.
Yeah. What would you just be treating like children, or is it more? Would you get involved in composite bonding? The restorative side of it.
So my main stream of business is obviously direct access through London Hygienists, and what I found was patients were coming to me under direct access for hygiene services, and I was spotting things and seeing things. Now, obviously, at that time, I was then referring them on, but that's partly the reason why I decided to go back to uni. I thought, gosh, I'm giving work away, work that I could easily be carrying out. I also wanted to help support the clinics I work in more. So, the dentists are doing big complex treatment cases, and none of these patients were having their treatment started until they'd had their periodontal health stabilized. But a lot of the time they just needed, a few restorations sort of here and there. And actually what happens now is they sort of refer those to me. So I sort of do the hygiene and the restorative work, sometimes on prescription, but other times it's through direct access. I'm sometimes their first port of call and someone that, that they've seen because they haven't been for years. And it sort of has allowed to sort of reinvent the patient journey and the offering, and improving sort of access to dental health services. I obviously am quite, still newly qualified as a therapist. So I pick and choose my battles in terms of what restorative work I carry out, but the majority of my patients are adult patients.
No, and I think we probably do establish a really good rapport compared to other clinical colleagues, because we often are given, that little extra time. And I think we do always go out of our way, to make sure we I suppose offer a full patient-centered care. I would say, and I think, Ali, you've mentioned with your course Thrive that for too long hygienists and therapists have been the unsung heroes of dentistry, and isn't it time we change that? And I think that's the premise of your course, in exploring the pillars of success. But how and when did this all come about in terms of you wanting to share that knowledge?
So again, it was one of those sort of things that I was quite, I wouldn't say fearful, but resistant to put out. But that was because of my own limiting belief factors. I thought, oh gosh, no one's going to want to come to that. No one's going to like it. What if it's nonsense? But the reason why is because people kept asking me, how did you do it? They were seeing the things that I was achieving and putting out there. And I guess that was appealing. And I thought, actually, there's nothing out there that's sort of non-clinical and a bit more business focused, particularly for hygienists and therapists. I myself have been on several, non-clinical courses as well. And I thought, what a nice way to sort of perhaps give back and continue to build this idea of community, and, give people confidence. As I said before, I remember a time when I was really miserable and unhappy, and at one point even considered giving up dentistry completely, and I'd only just sort of qualified. And I felt that I don't want anyone to ever go through that sort of feeling or journey. And if I can do something to help limit that, why not? And, continue to help. There's plenty of business and work for all of us out there. And I think it's a nice way to sort of merge together everything, clinically, but being able to sort of help you continue to thrive, with autonomy, and almost sort of help people become, micro organizations within organizations, because it all feeds back and loops round.
Lovely. Anna, did you have any upcoming dates for 2023 for your course Thrive?
And yeah, the next one will be on the 4th of February in London, and then later on in the year I think we'll be pushing forward with some online options as well.
I hope you've enjoyed this podcast, and please tell your friends and colleagues, as we're always interested here at Dental Protection to hear any ideas and suggestions. And you can also contact Anna directly via the London Hygienist, and from there can access Anna's one-day course Thrive, which is aimed at helping you excel in both your professional and personal life. Finally, for those that are listening, please do never feel alone. Support is only a phone call or email away, and having a support network, as Anna has mentioned, is so useful when times are hard.